Welcome, everybody. Ladies and gentlemen, distinguished guests, welcome to the 2023 Menzies School of Health Research Oration. My name is Alan Cass. Many of you may know me. I am the Menzies Director. I'd like to welcome our distinguished guests, Chief Minister Natasha Files, wonderful to have you here. Our orator, Deborah Natale, the CEO of the Council of Homeless Persons. Our award recipients, Vice Chancellor, wonderful always to have you with us at Menzies. Board members, I do have to say, both our Chair, Mr. Trevor Riley, and Deputy Chair, Leanne Little, are online. They couldn't be here in person, but are online. I think Leanne promised she'd send us a question. I think so. That's good. But welcome everybody to this event. Some quick housekeeping items. If we can please turn our mobiles off or to silent, that would be excellent. There are restroom facilities out this door to the right if people need them. We will be recording this event and taking some photos, just so that you're aware. And if we need to leave the room, there's obviously an exit here and also an exit up the back, which leads down the steps to here. Can I start by acknowledging the Larrakia people? Pay my respect to elders past, present and emerging. I'd also like to acknowledge as Menzies that we work with Aboriginal and Torres Strait Islander people and communities across the country and want to acknowledge those custodians of the lands and seas of Australia. I'd also like to acknowledge and welcome Aboriginal and Torres Strait Islander people tonight who've joined us for this event and are joining us online. And it's also wonderful to look around and see such a wonderful group of friends and colleagues to come together for this event. So first, can I invite Yvonne Odegaard to give us a welcome to country.
Good evening, the Chief Minister of the Northern Territory, Natasha Files, friends and invited guests. I'd also like to acknowledge the Larrakia here and family tonight, this evening. Bachiganyam, Gangwa, Gwalwa, Gulamerajin, Darandara. This is my welcome to Larrakia country to you all. I pay my respects to our elders, past, present and emerging elders. My name is Yvonne Odegaard and I'm a senior Larrakia proud saltwater woman and traditional owner. The Larrakia are saltwater people. Our clan group is Saltwater Crocodile Dangalaba and our language group is Gulamerajin. There are approximately 2,000 Larrakia people. The Larrakia Nation Aboriginal Corporation is the peak body and cultural authority for Larrakia. Larrakia Development Corporation is our business arm for Larrakia and provides employment, business opportunities for Larrakia through its own wealth and entrepreneurial activities. The Larrakia have achieved success as lawyers, doctors, teachers, sportsmen and women, and hold senior positions in government, as well as creating public art and sculptures around Darwin. The name for Darwin is Garamilla, meaning white stone. It is that priscillinite rock that you find around Darwin and on our cliff faces, on our cliffs. The Larrakia share their cultural stories through art, dance and performance and ceremonies. Some of what you see around you here in Darwin today. We have strong spiritual connection to land and sea and to our ancestors. We have a responsibility to care for country and to our sacred sites of significance. Message sticks were used by the Latakia to invite neighbouring tribes to come for a big Gunubi ceremony, or to invite family and other tribes to come for a cook-up, or just to relay a message to each other. We now use mobile phones and computers. Our Latakia have been welcoming you since the settlement of Darwin, Guttamilla. It is dada dada, all of us, responsibility to show respect as you walk on Latakia country. By showing respect for country, our ancestors will protect you, bless you, and watch over you spiritually. Gulametinda, Gulametajan, Walwa, Daraniki. This is saltwater country. This is Latakia land. Welcome. Welcome to you all.
Thank you, Yvonne, for your warm welcome to country. Over 40 years, the Larrakia people have welcomed Menzies. The partnership and collaboration with Larrakia people has been essential for the work we do. The wisdom and deep cultural knowledge that your people have brought to that partnership, underpins critical work here, and for that we thank you. The Menzies Oration is an annual public address which we hope will stimulate robust discussion about health, wellbeing and public policy relevant to the Territory and beyond. Menzies, as people know, seeks to address, I suppose, has a twin focus around issues of Aboriginal and Torres Strait Islander health and wellbeing, and global and tropical health as core focuses relevant to where we work and our critical partners here in the Territory and beyond. We're committed to research that delivers results for our community, our partners, and place a high priority on translating research into action. This evening, I'm delighted that Deborah Natale will deliver the 2023 oration titled "Why Public Policy Matters Now More Than Ever in the Northern Territory." Deborah is a lawyer who has demonstrated a commitment and passion for social justice and advocacy, and to work with a focused outlook on working with people who are experiencing real disadvantage. She has worked to really do things seeking to end homelessness, worked through a whole array of roles in Victoria and the Territory, in Victorian legal aid as a principal solicitor to the Tenants Victoria, and has really developed and pursued her interest in issues of justice and systemic reform. She worked obviously here in the Territory as CEO of NTCOS, the Northern Territory Council of Social Services, the peak body for the social and community sector in the Northern Territory. In that role, she would work very closely with cabinet ministers, chief ministers, heads of departments, but also with community members and the key organisations that make NTCOS, seeking to work to advocate for and achieve better social outcomes for individuals and communities with disadvantage. In that role, I met Deborah when you were a member and then I think chair of the Aboriginal Justice Agreement Steering Committee, one of the co-chairs of that. And I was able to work closely with you and see that passion, dedication and real commitment that you brought to such important work. It was a real pleasure to work with you in that role. Your impact in the Territory has been clear. Named one of the Territory's 100 most powerful women, I think, 2 years in a row. And recently she's taken a role as CEO of Council to Homeless Persons, and again wants to really challenge and work towards, I think, ending homelessness and advocating for the sector. So, ladies and gentlemen, I'm pleased to welcome Deborah Di Natale to present the 2023 Menzies Oration, and there'll be an opportunity for some questions and discussion at the end.
Just trying to find my glasses. So firstly, thank you everybody for coming tonight, for those of you in person and those who are joining us online. And I really want to thank Menzies for inviting me tonight to speak to two things that I'm incredibly passionate about, public policy and the Northern Territory. I've lived here for 5 years, and my husband often jokes that there are nail marks all the way across the Stuart Highway because coming back to Melbourne was really a call of duty rather than something that I wanted to do in terms of leaving. Before I start, I just also want to say thank you very much to the Chief Minister for coming tonight. I think it's a really wonderful thing to have you here, particularly because I'll be talking about Northern Territory policy, so that's great. I also, Trevor Riley, you're joining us online, so thank you very much, Trevor, for joining us. Ellen, Cass as the Dean, thank you very much for being here. And Professor Scott Bowman, who I unfortunately demoted tonight and referred to him as the Deputy Dean when he in fact is the Vice-Chancellor. So thank you for forgiving me on that. Now, don't worry, this is not death by PowerPoint. There are lots of great stories that go with it. I also want to acknowledge that this meeting is being hosted on Larrakia country and pay my respects to elders past and present. I want to make this statement on what was and what will always be Aboriginal land, that sovereignty was never ceded. And I extend that acknowledgement to any other Aboriginal and Torres Strait Islanders who are with us today, either in person or online. And obviously, in terms of timing, it's with great sadness that we saw that 80% of Aboriginal and Torres Strait Islanders across the country sought a very modest proposal in the Voice, and we weren't able to get that up. What I do say is that that will cement the commitment, I'm sure, of everybody in this room and online to ensure that we reach reconciliation in this country. So people often ask me, and I actually had a neighbour who said, I'm so sick of hearing about politics and public policy and does it really matter? And I say to people professionally and personally that it dictates every part of our lives, from the health of our communities to the future of the climate. And why it really is important is because when we look at legislation, budget allocation, the business of government, the business of NGOs, the business of the charity sector, all of that is driven by what we determine to be the public policy priorities in any jurisdiction. So one of the things I want to, I got told that I had to stimulate some debate, which is not very hard, as Alan would know, working with me on the governance committee, is that I want to introduce a new metric in terms of public policy and how we measure it. I'm going back more than a decade ago where I studied public policy at Melbourne University, and we all know what the measures of good public policy are here, but I want to introduce a new metric that I think should guide the process from here on. So the annoying thing about being back in Victoria is people say to me, oh, you're always talking about the fact that it's so complex. What's really so complex about being in the Northern Territory? And one of the things I'll be doing a really deep dive on tonight is the over-incarceration of Aboriginal Territorians. We've got domestic, family and sexual violence rates here that are 3 times higher than any other jurisdiction. And interestingly, even though I took leave today, someone said only you would go into court to listen to evidence from Marcia Langton, but she also reminds us of the stark reality today when she gave evidence that homicide rates in the NT as a result of domestic, family and sexual violence are 7 times the national average. Homelessness is 12 times higher. The cost of service delivery in remote costs us so much, and obviously those Territorians who are on income support are the highest in the country. And what is one of the key things that is a challenge for us in the Northern Territory is our national funding model. So we have a national funding model that is based on a formula that looks at population rather than need. Now, when you look at all of those other categories in the Northern Territory, it's really easy. We've got evidence to establish we've got more need than any other jurisdiction. And until we change that model from a population-based formula to a needs-based formula, it's going to be really hard to get ahead. So, and obviously for the Territory that relies so heavily on federal government funding, that is something we really need to be working towards. Now, the good news is I'm going to leave you with optimism, so don't look at this and think it's all doom and gloom. We're going to talk about some really good policy initiatives we've got that have addressed this. The imprisonment in the Northern Territory is among not just the highest in the country, but in fact the highest in the world. That is something where we don't want to be leading, and we need to change that story. The rates of children in prison in the NT are 5 times higher than the national rate. And when I read this next number, I just want to also mention that in court today, Marcia Langton's evidence talked about institutional racism and how that has contributed to a number of these statistics. So 86% of adult prisoners were Aboriginal in December 2021, and 26% of the proportion of NT residents that are identified as Aboriginal Torres Strait Islander were 26%. I don't need to tell anyone in this room or online what those numbers are telling us. So as we know, the goal of most public policy is to provide solutions to complex problems. I started working as a lawyer in 2000. It's 2023, so 23 years later, if this stuff were easy, we would have figured it out by now. So I think it's really clear that it's difficult work, and it's really difficult to get the policy levers right in this space. So the first example I want to pick up on is the over-incarceration rates of Aboriginal Territorians and why it matters now more than ever. And the next slide that I'll show you will be a really clear indicator that the graph is going up, and that is not changing. And someone said, well, why does it really matter that much? It matters because what communities tell us when a member of their family is incarcerated, and I worked across 44 remote communities in the top end, is that they feel disconnected from culture, disconnected from their family, disconnected from language, and it has a real impact not just on the individual, but the families and the communities. And we also know that anywhere in this country, if you don't have the supports while you are incarcerated, we have this cycle that is just highly repetitious. I also want to share with you, and I apologise if I don't pronounce this right. I pronounce most communities right, but I find this one very hard. The Alparullum, southeast Tennant Creek, so Lake Nash. When I went out there and I was part of the Aboriginal Justice consultation process, I was sitting and having coffee, and one of the Aboriginal grandmothers came up to me and said, can you tell me when my daughter is coming out of jail? And I said to her, oh, sorry, I haven't got that information, but perhaps we can go to one of the local police officers and find out. And as we walked across to the police station, I started to hear her story. 4 grandchildren in her care, adult children in her care, calling Centrelink for 4 hours and not being able to get through. And interestingly enough, I naively said, oh, it'd be great to be good when you are able to get your daughter back so you can have some more help. And she said to me, yes and no. Yes, because I want her back, but no, because she's had some challenges in terms of alcohol dependence. And there's nowhere here in community where she's able to get the support that she needs. So what we have, which I'll link into later, is a community that is feeling very disheartened because we don't have the supports that we need out in remote communities, and we need to change that story as well. So this was what I was referring to before. The orange one, as you can see, that we have massive increases in terms of the adult prisoner population that is incarcerated, and it's going at an even higher rate for young people. So I'm going to talk to you tonight and do a deep dive on the Aboriginal Justice Agreement. I was originally, I was part of that governance group for over 3 years, and I have to say that we are going to have a look at whether it's good public policy and whether we've got the right approach. I think I gave that away when I said I'm feeling very optimistic about the future. And just to link in, why am I talking about justice at the School of Health Research, which a couple of colleagues did ask me? I think I don't need to tell anybody in this room around the evidence of the social determinants of health. They are very well established. And the evidence of not addressing legal outcomes early and poor health outcomes is really clear. And I do want to say that in Australia now, and also in the NT, we have a number of health justice partnerships. We haven't really adopted it at scale, but we're getting there. And where is that? Where did we get the evidence that health justice partnerships work? We got that from the US. So the US does sometimes deliver us some really good outcomes. And what in the US, they're called medical legal partnerships. And how did that movement start? That movement started because a 9-year-old went to their GP and had a respiratory problem. The doctor did what doctors do and prescribed medication for the respiratory problem. He said, come back in 5 weeks and this medication works 98% of the time. So the 9-year-old comes back after 5 weeks, no improvement. The doctor says, this is really odd. This medication usually works. What I'll do is I'll just stronger dose and come back in 5 weeks. The 9-year-old comes back to the doctor with his parents 5 weeks later. So we're 10 weeks in now. And the doctor says, this is really unusual. I've not seen a case like it where the respiratory problems have not improved. And it took an allied health professional in the room to say, oh, you know what? In terms of your living environment, where are you going back? And the parents say, actually, we're going back into a house and we're trying to talk to our landlord in terms of the rising damp that we've got there. So it didn't matter how many times this young boy had come in to get medication, never going to resolve it if we didn't have a look at the living conditions. So from there, the movement was born that we need to be really ensuring that we have got all of these systems working well together. And then the GP got somebody to call the landlord and to ensure that the rising damp was sorted out. In terms of the approach in the US, they are very, very different in how they're adopted depending on where you go and what you see there. But the 3 core activities are providing legal assistance in a healthcare setting. The second one is transforming health and legal institutions and their practices. And the third one is influencing policy change. So those are the 3 core principles, and they operate at scale in the US. And we've actually got a couple that are working really well here in the Territory too. So now going back back to Melbourne, it's really very annoying to hear people say, oh, if only the NT did it this way, if only they did it this way. And often we don't talk about how the Northern Territory have become leaders in some of this complex space that we work in. And we should be really proud of what we're doing and what we're achieving, and particularly the reform we're doing in the justice space, which I have said to many colleagues is leading the way across the country. So For those who aren't familiar with it, we have adopted the Aboriginal Justice Agreement. And that sounds like, oh, there are lots of different agreements and people sign them all the time, but there has never been a reform agenda that has had such early indicators of success as this Aboriginal Justice Agreement. So just in terms of what it tries to, what it has as its core 3 principles, reduce offending and imprisonment rates of Aboriginal Territorians, engage and support Aboriginal leadership, and improve justice responses and services for Aboriginal Territorians. And that third one looks a bit wishy-washy. I've been told I've got to stay near the microphone for people online. That third one sounds a bit, oh, really, is that so great? Every single consultation that I went to, whether it was a community of 250 people out in the west of Alice Springs, or whether it was a large community like Catherine, every single community said to Leanne Little, who was running the consultation process, she said, oh, you're not happy with this, but do you know who you can complain to? No. And not one person had heard of the Children's Commissioner, the Anti-Discrimination Commissioner, the Ombudsman. So these systems are great when you say we've got these great institutions and we've got the best practice policies in there, but they don't really mean anything if the people who need them can't access them. So that's why I see that as actually quite a core pillar of the aims in the agreement. And I also want to congratulate the Northern Territory Government on like a number of things, but this one in particular. There has never been a consultation process in this country that has been this broad and this deep. And we had a government that were funding the Aboriginal Justice Unit to go to communities, whether they were 200 or 3,000 people. And I think that has really been part of the success of ensuring that we're able to get this reform implemented. And there are lots of great parts of the reform, but I got told I wasn't allowed to speak for more than an hour, so I won't. The big parts are the law and justice groups, the alternative to custody model that we've adopted in Alice Springs, and the community courts that this PowerPoint says is going to start later this year, but I got a call this morning, it'll start probably early next year. And I want to just talk to some of these in terms of, right, let's just talk about the early indicators of success first and then I'll go back. The law and justice groups, we went out to Kintore and that was the first law and justice group that was launched by the Aboriginal Justice Unit. And the then Attorney General, Selena Ubo, came out to launch that. When we went out to that community, people said to me, you're never going to get anyone who wants to stand up and be part of the law and justice groups. It just won't happen. These communities are so overwhelmed. They've got so many other things to worry about. Well, after Leanne Little went out to that community, 3 days later, 8 people had put their names up and said, we want to be part of the solution. And I think part of the success of the Aboriginal Justice Agreement has been that, as you heard, you've got communities that are feeling quite disheartened, is that Leanne Little's approach as a champion meant that she was able to not only get trust from those members, but she was able to fill all of those communities with hope that there was a chance for a better future. And not only did they participate, but they stood up and said, we want to be part of the solution and we're going to create these groups. And some of the, I'm big enough to say that I have completely thought that all we were going to do with the law and justice groups was have communities and young people who are at court. We'd have law and justice groups that could come in and would be able to write character references and support people in what is often a very foreign process. But the unintended consequences of these groups have been quite extraordinary. We've had the groups who have become peacemakers, and we also have one of the, hope I can find it now. So in Groot, that is a fantastic example and local example that they have had this program in place since 2018. And NT police data shows the number of offences committed by young people in 2018 and 2019 dropped from 346 to 17. Now that, as a standalone statistic, will tell you that when you empower Aboriginal communities to be part of the solution, it works. And that's been lots of things. It's been the early processes that are put in place. Kids aren't going to school. What can we do to engage them to go to school? I think that's, just been quite an extraordinary outcome. The alternative to custody model in Alice Springs, for people who are working in health, you might not know about this model, but what it does is it provides an alternative for Aboriginal women who are often repeat offenders and have been charged and sentenced with some serious offences to be part of a program that is called the Alternative to Custody. And I actually went there and heard from the women directly, who said they were for the first time ever looking forward to going back to community. From June 2020, 32 completed the 6-month program, 2 reoffended. Now, I've got to put a caveat on that. That's excluding breaches of orders, but breaches of orders are like breaching curfew. I mean, if you've got a teenager, that's kind of the rite of passage, so I don't sort of count those. I think they're not essential in the scheme of things. And 3 clients gave birth during the program and were able to keep caring for their children. That is unheard of in any jail across this country, and I don't need to tell people here the evidence of what happens to mum when she's able to keep her child. Great long-term health comes for the mother who can continue to care for a child, and greater long-term outcomes for the child being able to stay with their mum. In terms of repeat offending, this is, for people who are in justice, this is kind of like get your pom-poms and go out and celebrate. The general recidivism rate is 60%, and here you've got 20%. So we know that it works. The only drawback in terms of this program is that it only has the capacity for 10 women. But we know that this works, and we know that if we keep backing these solutions, we're going to get the right outcomes. And I feel like I should go back, because otherwise it wouldn't be fair for all the work that Alan's done over the years being part of the meeting. When we ask ourselves, how did we get these early indicators of success? How did we make it work? I think really critical to this particular study is that there were a team of experts and partners who came together. You had the Attorney General's Department, you had Aboriginal community controlled organisations, you had the philanthropic fund Paul Ramsey. And what was different about this, we've got lots of governance models everywhere that we can look at, but what was really different is that every single person in that room was an equal partner, and I think that makes a real difference. So for someone who's worked in, the charity sector and the NGO sector for such a long time, often you can feel like there's a bit of disparity, and I'm sure universities do feel it to some extent as well, when you've got somebody who is funding a particular initiative and brief, and you actually are the recipient and beneficiary of those funds. Sometimes the freedom is not what you would like it to be. And I do want to also say it wasn't a bed of roses, was it, Alan? There were lots of good, robust discussions about what we thought should be prioritised, and the fact that we landed where we did, I think, is a credit to everyone who was part of that governance committee. What else really did assist was you need a strong leader and champion of change. And Leanne Little is a force to be reckoned with for anyone who has worked with her or travelled with her. I look at the schedule when I was travelling with her and thought, can we seriously land in one more remote community today? Yes, we can, because we're going to start at 4:30 a.m. So I think the fact that she not only had a vision, She also made sure that she got the authorising environment, and she got key partners and collaborators to be part of it. But the most important thing she did, and I'm sure she's listening today and she will disagree and say, that is not right, that's not the most important thing, is that went to a community consultation with, rightly, members of the community saying to us, how is this agreement going to be different? We've seen it all before. We saw the Black Deaths in custody. We saw the Royal Commission into young children in detention and children in need of protection, and nothing is changing. So to get from that space to a space of not only do we want to participate and commit to letting you know what we think the solutions are, we want to stand up and be true partners in this, and I think that's a real credit to her. And the other thing is we have had really supportive cabinet ministers, and I'm not just saying this because the chief minister is here. Having a chief minister that supports it means that we can make this change happen. And one of the other things that people were probably quite sick of me going on about at the Governance Committee is I kept saying we need bipartisan support. In government, we just don't know how long people will last, and this stuff is not going to take an election cycle. We need a commitment 10 years and beyond, and it really is a credit to this government and to the CLP that together they signed on to this Aboriginal reform agenda, which will really change the way we deliver justice in the Northern Territory. So that bipartisan support has really assisted with the authorising environment. So when we look at how was such reform in the policy space possible, I reflect on that time and say, obviously there was a really clear problem to solve. We all knew that we needed to change the trajectory of Aboriginal people who were disproportionately represented in the justice system. We had a really strong and visionary leader in Leanne Little. We had Leanne and a government that provided the resources to make it happen, to do the deepest and broadest consultation that we've ever done for a policy. A supportive and visionary Attorney General in Chancey Paik, and I don't normally do this, but I just want to sing out another place where the Northern Territory has been the lead, has been that Chancey was the first Attorney General in this country to raise the age of criminal responsibility from 10 to 12 and needs to be applauded for that. And Victoria looked to that, and then I think it got Victoria moving, so that was a good thing. Not moving as quickly as we did, can I say. And a governance committee that was made up of the Attorney General's Department, ACOs, Peaks, Philanthropy, and the bipartisan support. I think that's what got us to where we are, and as I say, something we need to feel proud of. So when to circle back in terms of the metrics, I say that the success of any public policy is really determined by consultation and community leadership. And I hope that this presentation has demonstrated that if we have an expansive view where community is not just in a basket of stakeholders where we tick them off, but in fact at the centre of co-creation, then change can happen. Thank you.
So we do have time for some questions or comments. Wonderful to hear about that incredible process that have worked towards the Aboriginal Justice Agreement. Just want to echo that remarkable consultation across the Territory with so many groups, and not only did it occur, but there was such effort to capture that and what was important to communities and synthesise that and think, what did that mean? And for that to flow through to, I think, the recommendations that were made as part of the process. So it was a remarkable effort of a huge group of people, and well supported for that to happen. Yes, Trish.
Thank you, Deborah. Trish Angus.
Hi, Trish.
Thank you for your presentation. And what I'm about to say doesn't in any way diminish and not meant to diminish anything you told us. And all of the wonderful public policy work. There is going to be a question at the end of my preface. The wonderful public policy work that came about, particularly Leanne's work with the Justice Agreement, all done, I can speak louder, all done on well-researched, validated data. And some of it, the data that was talked about goes back 2018, 2019, I saw 2021 come up there. Can we fast forward, please, to 2024, next year? And my question will be, can you shed a ray of sunshine and light on a lot of us feeling, 40% of Australians feeling a bit battered, shattered, and pissed off with all of this good policy work that's been done when Aboriginal people wanted to have a say and involvement in funding policy and programs that affect our lives and all of the things you mentioned. We don't want to be voiceless, we don't want to be hopeless, and we most certainly don't want to be homeless, your core job. But I'm not feeling very heartened that that 60% of Australians, all the urban seats in the Northern Territory, feel the same as those 60% Australians, except for wonderful people that are in this room. I'm not feeling very heartened that there's going to be good public policy that will even achieve all those good things. So in your work, even with this government, and I'm not saying it because Natasha's in the room either, even with a government that's like this one, I'm not even confident they can do what we want them to do. We don't have a voice. How are we going to influence public policy? It's not the public policy that's at fault. It's the way it is implemented and the energy, the keenness to implement it. People do good public policy work every day. They dream it, they sleep it, they do it. It's not them that we're worried about. It's the governments and the doers and the people who influence them. We don't have a voice to do that.
I think that is a very good question, and I'm normally pretty quick to respond to that. All I can say, Trish, is I feel shame that this country wasn't able to support the voice to Parliament. It's very hard when you work in issues that are full of social policy areas that are so complex where you want them to be fixed to feel optimistic. But I do have a level of optimism around the representation in the Northern Territory in terms of its Aboriginal leaders, which we've had more than ever before in the Territory. How you get your voice across is a battle that I think we need to just keep fighting for. It's a shame that we have to be in that space, and it's a shame that it's not given as of right. But I can assure you that you are amongst friends here and with people online and people at the Menzies Institute who are not going to give up on getting reconciliation in this country. Oh, and can I take this opportunity to also want to shout out to A, who's about to ask me a question, who's a freelance journalist. One of the other key successes to the Aboriginal Justice Agreement is we need people, and I know you're no longer in the mainstream media newspaper here, and I think that's a great loss to Territory News, but we need to tell a different story, and I think the fear campaign is really easy. I mean, we saw it play out with the Yes campaign and the fear campaign that crime is out of control when the statistics are not representing that. The idea that we've got really good outcomes in group, nobody's getting that in the paper. But I want to say to A, you actually changed a whole tone that was going on, and during that period I really do think that that has helped in terms of developing and shaping community attitudes.
Thanks, but I think it's always a community effort in changing those attitudes, and as media we can only do that with advocates like Leanne Little and yourself. So yeah, that's what I'd say back to that. But I wanted you to flick back to one of your slides, which was the number of Northern Territory Aboriginals in prison and criminal children's courts, like figure 11, this one. I guess my question is as someone who relies on the Aboriginal Justice Agreement in their day-to-day job regularly, and to hold governments to account, one of its key priorities was to reduce the rate of Aboriginal incarceration. This figure shows that since the AJA came into effect, it has not done that. How do we know that this is good public policy when this is a clear failing?
You're very cheeky, eh? I'll take this up with you later. So we've got to remember that the AJA was signed very recently. Some of these changes in terms of the alternative to custody model can only facilitate 10 Aboriginal women. And until we provide these solutions at scale, we're not really going to see that number change. So I would say that we've got the right policy levers in place, but we just don't have them at scale. And once we do, you will see a very different picture here.
Today is Steps Day.
Hi, my name's Bree. I'm quite new to the Territory. I've been here less than a year, so I wasn't familiar with all this work, and it was just amazing hearing about it. Thank you. So I was just going to ask you, what do you think the opportunities are to kind of replicate that success, or where are you kind of most hopeful that this kind of public policy model could be utilised or replicated in the Territory?
Look, I think as long as we keep going with the law and justice groups and we continue to ensure that we have not just one community court but many of them are funded across the Territory, and I think if we continue at scale to look at the alternative to custody model, not just in Alice Springs but also in Darwin, and we have obviously got one that is for women, but we also need one for men. The domestic, family and sexual violence rates, which I was reminded about today when I went to the coronial, is one of those areas where when you have a system where men who are in jail predominantly are there as a result of assaults due to DV, and you are not eligible for a program if you are sentenced for anything less than 12 months, right there is a glaring example of what we need to do. Provide the right programs while you have people incarcerated. Otherwise, these numbers will just keep, increasing, or even if they stabilise, that is just not acceptable.
Just checking if there's no more questions in the room, otherwise we might go online, but it looks like there might be a question or two that you've still got in your room, so we'll go down the front and then up to the back.
Thanks, Deb. I think you stepped us through a really nice example of developing good public policy. But I want to return to one of the comments Trish made, and that is, what are the steps in implementing good public policy? And, you've just said that it's a bit too early, perhaps, with this example. Because too often we see, increasingly better written public policy, but we're still seeing a lot of failures in the implementation of that policy, particularly at scale. I mean, too many pilot projects that never go beyond that. And today I just happened to be reading an article which talked about a German proverb. I'm not German, so I'm not going to say it in German. That the opposite of good is good intentions. And I'm worrying that there's a lot of good intentions in policies that are not implemented. And what are the steps to make sure that they're implemented?
So one of the things that we were really clear about as part of the governance committee was to make sure that we had a very solid evaluation base. And I think it's very, very hard to fight against the evidence of what is working. And one of the things that does fill me with optimism, and you've got to sort of grab what you can when you're in these areas, is that we have got early indicators of success. Also, it doesn't matter what side of politics you're on or where you live, there isn't a single person in the Northern Territory, and I know this through my Smarter Justice campaign, where we also did polling all across the Northern Territory, there isn't a single person who said what we've got in terms of the way we're responding to crime is working. So that to me says we've got an appetite for change and we know what we have is not working, and a combination of those two things means we're ready for this reform.
Good evening, everyone. My name is Tanya Bala. I didn't have a question as such, but I did want to make a comment. There we go. Yeah, sorry, I don't have a question, but I did want to highlight the fact that we were invited here this evening by Pirawani from the Tiwi Islands. And I think that what that shows is the importance of Indigenous ways, because we didn't know what we were coming to celebrate his achievement. However, being in this room and what you've spoken about is integral to our business and what we do in our communities. And that is Aboriginal way, that we weren't put in this room for no reason, if that makes sense. So I wanted to highlight how that's not formalised, it's not written into policy, yet it is an Aboriginal way of being together and connected that has put something in place ready for 2024, because we wouldn't have otherwise had that information, which will help us to deliver on what we deliver. So just wanted to say thank you, and the information is very helpful.
Thanks. Was I right to understand that the program in Alice Springs is for women who have experienced themselves domestic or sexual violence and then incarcerated for separate offending?
No, and I'm sorry if I've miscommunicated that. The alternative to custody model is for Aboriginal women who have offended.
Okay.
It can include domestic violence, but it is certainly not limited to that.
Okay. It does seem like there is a lot of people who end up in the criminal justice system who have first been victims themselves of something, and it seems like many of the programs that you've talked about tonight are geared towards supporting the defendant of criminal offending with rehabilitating. I was just wondering whether in this work there has been any programs to assist victim survivors, taking into account that those people can sometimes react to that trauma by becoming offenders themselves.
Whenever that was a question that played out quite a bit while we were developing the AJA, and the way the governance committee were viewing that was, in order for us to be able to ensure that there are less victims, we need to address the crime. And absolutely, we always acknowledge the trauma that the victims feel when they have been, the victim of a crime. But the focus of the agreement is not specifically on victims, but we say that when this policy is implemented and we're addressing the criminal offending behaviour, then that will assist long term in terms of there being less victims of crime.
Just checking if there's any further questions
Where will I hear them? Okay.
There was a question from online, just asking, I think you described the Paul Ramsay Foundation having a role working with the committee, and whether you could outline a bit more their engagement in the process.
Sure. So I'm one of the first people to admit I got it wrong, and when I was part of the agreement, government and others came and said, we've got a philanthropist who wants to be part and wants to support this. And I said, oh, that's just nonsense. We don't need philanthropy. This is the business of government. People just want to come in and give money and think they're going to fix the problem. Then I put my tail between my legs and went home that night and actually decided to Google Paul Ramsay. And when actually this is a really sophisticated philanthropist. They're not coming in to support a pilot project. They're not coming in and saying, we're going to give you $100,000. I mean, they were in it for the long haul. And when you look at the programs that they've done with other Aboriginal communities across the country, I thought, not only will they be able to participate in terms of a long-term funding model, but they were in it for a decade. They knew this work and knew that we weren't going to turn this around very quickly. And they have committed to a significant sum of funding. But not only that, their expertise in running this in some other parts of Australia meant that we had the learnings of what worked there and what they tried and didn't work. And they were absolutely key in saying, we want to be guided by community. We're not here to say anything. We're only here to provide our experiences of what worked and what didn't work. And then at the end of the day, we're going to back what the community want in terms of the solution. So I have to say, as a funder, I found them really, really easy to work with. High trust, low documents, really good model.
Last question over here.
In the lead up to the example, it'd be really great for Aboriginal people sitting in the room that want to have a strength-based approach rather than a deficit approach. Like, it's getting tiring. Is the public policy leading up to these results was the removal of children for about 100 years. That was the public policy. It had a dramatic effect on human beings and their behaviour. We just had the Royal Commission into institutional abuse in 2017, sexual institutional abuse, where about 40,000 people gave evidence, 39,000 of them were non-Indigenous. There's something basically wrong with the model. And the final thing is, because that would add context to this data. And I think context is what's missing from this presentation, because it's always painting a deficit model. With this young fella sitting here and other young Aboriginal people sitting here, anyone would think there's something wrong with Aboriginal people. And I'd ask people after the no vote to consider the racism and the effects that we know happens all around the world. Incarceration rates like this happen in populations all around the world. It's not isolated to the Northern Territory. It's not isolated to Australia. We know the causes of it, and it's arrived. And that would help empower people to reflect on their own behaviours. Those figures there, if you go back 100 years, there wasn't a prison in the Northern Territory. Where did this come from?
Thank you. And I did try to give that context, but perhaps didn't do it to the level that it required. But it was very clear that in terms of those numbers, what we have is institutional racism. That is why we have this level of disproportionate representation. And I don't think anyone would see those numbers and see that as anything other than institutional racism. And, you know, I agree with you around the yes vote piece.
And it'd be really great to get two reflections of two audiences this is pitching at. Aboriginal people building up their strength to understand they're surviving something. Their resilience is unbelievable. This lady here, her ability to go and do what she does is off the charts. And then putting it into the context of the non-Indigenous people to reflect on the behaviours, reflect on their behaviours.
Thank you.
Thank you, Deb, for that very thought-provoking presentation. Thank you, everybody, for your comments and thoughts. There will be opportunities to continue the discussion this evening. Such critically important issues raised, which do need reflection and people thinking about how to take things together positively in partnership. Perhaps in some ways, that lets us move forward to some of the other opportunities that we have when we have this oration, and that is to provide some recognition of remarkable contributors through their work at Menzies with community to make a difference, a positive difference. And I think when I introduce to you the people who, when we can present the Menzies Medallion and Companionship Awards, I think those remarkable examples of people coming together to partner and do things that have positive impact from our community is the type of story that I hope we can tell. So first, I'd like to talk to the Menzies Medallion, which is the highest award offered by the Menzies board, and it recognises people who have made a substantial and quite remarkable contribution to health and wellbeing in the Northern Territory. And this year, it's my privilege to present the Menzies Medallion to Professor Tricia Nagel and Pach Janama Robert Mills. Together, Tricia and Robert have worked in close partnership for over 20 years on the Aim High, Stay Strong program at Menzies. Professor Nagel has 40 years history experience in the NT as a clinician, educator, researcher, and leader of the mental health program at Menzies. Pach Robert Mills was born Larrakia, Kungarakan, Mayali, Jungman, Jarwin, and Gorinji. He's a traditional owner who has trained as a health worker, has worked in research, alcohol and other drug and mental health services, language preservation, music, and football. Through their partnership at Menzies, they have made remarkable contributions to Indigenous mental health services and research, to culturally appropriate research methodologies, to training and mentoring, to Indigenous leadership in research. Together, their work has resulted in changes to guidelines and routine care for First Nations people across not just the Territory, but more broadly, and rural and remote mental health care across Australia. Just last month, they launched our new electronic mental health resource during Mental Health Week. This digital interactive Stay Strong care plan allows for a holistic, strengths-based and person-centred approach to improving wellbeing and care. Congratulations to Tricia and Robert. If you can come up, we can present the... Yeah.
Thank you very much to everyone online for your patience while we present the 2023 Menzies Medallion to Professor Tricia Nagel and Pach Janama Robert Mills. Who will now say a few words?
I'm just going to say thank you. Thank you to the attendees. Thank you to Menzies for the recognition. Thank you to the team, and thank you to Janima Robert Mills, who's been such a wonderful colleague over the years. So I'm not going to say much more than that. There's still, as we heard, lots more work to do.
What's in this?
Present that'll last a little bit longer than
Chocolate. All right. I don't know what this is all about. I don't know what it means, but it seems good because apparently they don't get given out very often. So thought I had to dress up today. Normally it looked like I fell off a truck. I wouldn't be getting anything like this if it wasn't for Professor Nagel. I met Tricia in the 90s, and I used to be an Aboriginal health worker at Bagot. And I applied for a job, and that's the first time I met Trish, and I got the job. And I was concerned as a community member how our people were being diagnosed in the hospital, especially when most of our countrymen and countrywomen didn't even speak English. So I was concerned that people were being misdiagnosed. How do you know what's wrong with that person if you don't understand their language? And so there was a push in the 90s to include Aboriginal health workers, then there was a push for interpreter services, and then a push for Aboriginal liaison officers, which is something we never had here in Darwin from, let's say, the 50s or the 60s up to the 80s. So we had a 4-step motivational care plan called Stay Strong. And it was Professor Nagel's idea, and it was her clinical approach. And I saw it as my job to culturally appropriatise the clinical message. And we were a good team. We are a good team. A couple of weeks ago, we launched a digital app, Stay Strong app. So we converted the paper-based 4-step motivational care plan into a digital situation. You can now download it on your phone. You can have mental health support on your phone immediately for free. And I'd like to have a quick shout out to my colleague, Michelle Sweet. We've taken Professor Nagel's initiative, and we've been just about every state and territory except Tasmania. And we have introduced that care plan to tens of thousands of people. And so after this it's about 25 years since we met. And the effect that myself and Michelle and the rest of the team are having around Australia makes me very proud. So I'm proud to be a part of this, and I appreciate this, whatever it is. And the last thing, last week, I think it was, or a fortnight ago, was National Mental Health Week. So you people, take care of yourselves and your loved ones. Thank you.
And can I say personally, I've had the privilege of working with the team when we adapted and you led, the adaptation of that tool to work with Aboriginal people living with kidney disease. So important, that work, and shows the care and expert knowledge you have brought together and as a team to development of those tools, that we can find more and more areas where it's critical that we adapt work with community to address issues of health and wellbeing for those people. So thank you for that ongoing work. In 2018, the Menzies board created a new award, the Companion of Menzies. This award was established to recognise the exceptional contribution and support to the development and success of Menzies School of Health Research. And we have two wonderful recipients in 2023, being Ms. Heather Dantuan and Mr. Marius Pirawangi Purantata Mary. Heather, it's hard to talk about Heather. She's had decades of experience in the field of health, starting as a registered nurse and midwife, working as a leader in Aboriginal health services and general health services, particularly originally in Western Australia. She's then worked extensively in the health research area, I think for quite a period at the Institute for Child Health Research in Perth, now Telethon Kids Institute, and of course here at Menzies, where we were all privileged to work with Heather for almost a decade. Not only has she played critical leadership roles across institutions like Menzies, but she has also had an incredible focus and interest in maternal and child health, doing some incredibly important work around fetal alcohol spectrum disorder, not just work that has increased health professionals and health services awareness and understanding and tools and skills, but also trying to engage with people in community about their understanding, thinking and approaches to these important problems. Heather's a leader and mentor for all of us. She had that incredibly important role here at Menzies as our Deputy Director for Aboriginal Health Programs and a leader for our Aboriginal and Torres Strait Islander Capacity Building Unit. And now she continues that work at the Next Gen Hub, part of the OCA National Network for Aboriginal and Torres Strait Islander Researchers. Wonderful to have you back with us, Heather, and to be able to recognise you as a Menzies companion in this way. Marius Pirawangi Purantata Mary is a Tiwi elder, ceremonial leader, songman, and Ask the Specialist. He was instrumental in the development of the Ask the Specialist podcasts. He shared personal experiences as someone who uses health services with professional experience as a health worker, a teacher, and deep cultural knowledge in developing of an incredibly important resource, answering questions of doctors at Royal Darwin Hospital about how they could better work with their Aboriginal patients. He was elected Deputy Mayor with the Tiwi Islands Regional Council and was on the Tiwi Land Council for decades, has worked as a teacher, worked as an Aboriginal health practitioner, and established the Visiting Elders program for Darwin Prison. For Menzies, he has worked both as a collaborator and an incredibly important expert with his knowledge, his skills and insights that he's brought to a whole array of programs across Menzies. So we thank him for his continued support, his engagement, and that expert knowledge that he brings to our work. So congratulations, Heather and Pirawangi.
Thank you once again, everyone online, for your patience while we just present these awards and take a few photos.
All right. Oh, thank you. It's a privilege and an honour to be back in Darwin. Any excuse to come back to Darwin. I've had a yearning for it for a while. And I just want to say, working in WA, we always look to the Northern Territory for leadership in Aboriginal health and in Aboriginal health research. And I'm always sort of saying, not that I'm biased, but, you know, you want to look at what we're doing here. I'd like to dedicate this award to my parents, who are no longer with me, who kept me on the straight and narrow when I often drifted off the path and led me to places like this, and to all those Aboriginal and Torres Strait Islanders who went a long time before me to pave out the way in health. And some of them in this room. Trish, thank you. And thank you very much for this award. It's lovely. Thank you.
I want to first pay my respect to our brothers and sisters, the Larakiama. Also acknowledge other Aboriginal and Torres Strait Islanders in the room, the Menzies School of Health Research staff that are here, other dignitaries, and especially Chief Minister Natasha, thank you for coming. And our friends that are here and family, thank you. And those that are watching on TV, I've sent a link to a lot of families back home. So they're watching. Look, it's what I'm going to say quickly is please allow me to say, to start with something funny. A husband is sitting in the lounge room in their house with his wife, and he's reading a newspaper. The wife comes up behind him with a small saucepan and goes whack on his head. And he says, well, what's that for? And she said, well, that's for the piece of note that I found in your trousers that had the name Mary Lou on it. And he says, oh, dear, that's the name of a horse that I put my bet on. Okay. 2 weeks later, she gets a bigger saucepan and goes whack on his head again. Oh, what was that again? What is that for? And she says, well, your horse just rang. Anyway, I've got a few. I'd like to just inform you that I've been on a spiritual pathway for the last 19 years since I've stopped drinking, and trying to find out actually about who I am, about myself. And I'm doing that through working with people, wonderful people such as Menzies, School of Health Research, meeting lots of great people that I've had the privilege to have met. And it's been a fascinating journey, I can honestly tell you. Some wonderful people that I will never forget. So I just want to say some things that it's a bit different, but these are the sayings that I'm really come to challenge myself of one of those things that I'm finding out who I am, where I've been, where I am, and where I'm going. So I'm just going to read through them. So bear with me. The only way not to have regrets tomorrow is to do what's right today. Excellence is doing what's right, especially when no one is looking, because who you are when no one is looking is really who you are. Discipline means that I'm going to pay the price now for something good later. And nothing in life is free. And if you ever get something free, know that someone else had to pay for it. Be grateful.
we know this is no reflection on the Chief Minister, but people are sitting around for the government to give them something free. Now, just stop and think that they don't have any money and they don't give you anything free if they don't take it away from somebody else. So there's just some of the things that I just wanted to say, but it's really about challenging myself, actually. I'm on this journey, and I can tell you it's been a blessing so far, wonderful journey to have worked, and I want to thank especially to Amine and Sister being here. Thank you so much, and thank you to the organizers of this wonderful event. Thank you.
So thank you, everybody, for attending tonight's oration and presentation of the awards. That finishes the formal events. You're welcome to join us for some light refreshments in the foyer and continue the discussion. Such important issues that have been raised and discussed today. I was thinking before the event, you know, over the last month, whenever you listen to the news, turn on your phone, listen to the radio or social media or the television, there is often such distress and despair around the world currently. And to hear some of the stories of people working together in partnership to achieve common good here in the Territory, I find very, I look at what appears to me to be a fairly crazy world out there and see incredible value in us coming together in partnership to address these really important things. That certainly makes me feel quite happy that this is a place where we can work together to make a difference. Thank you for the passion, commitment, knowledge, cultural knowledge and expertise and professional knowledge that people bring. If we can keep hold of that partnership and move forward together, we'll show people how we can achieve reconciliation and how we can work for the common good of people across the Territory. Thank you for coming. Keep talking. I've made a mistake by not giving you
A photo opportunity.
flowers and a photo opportunity.
So, Deborah, just a photo with you and Alan, and then thank you so much to everyone who has joined us online. We're just taking some final photos, but that ends the evening's official proceedings. We look forward to seeing you at our upcoming events. Thank you.